So immunotherapy for the prevention and treatment of Alzheimer's disease. That's exactly what my head point and what I'm going to talk to you about here today. So the very shortly first about the company. It was founded by Dr. Sandberg and Professor Had back in 2008, and it was a cooperation that they had in Gothenburg when they were doing studies and development on doctor level together with the Gothenburg University. And what they came out with was a peptide which they updated in a technological fashion. So, and they named it A-beta-CC, so amyloid beta CC, which is actually amyloid beta cysteine, which is their invention. And this is a very unique opportunity that gives us a chance to mimic the actual species that is causing Alzheimer's disease in the brain. So we are actually doing a synthetic form of the actual form which is causing the disease. I will come back to that, but this is what the company is working with. We are employing some 15 full-time employees globally. And among the shareholders, I would just like to point out Mivac Development, which is the holding company of or controlled by Geo Ventures, and they are a holding company for different projects related to Gothenburg University. But they are controlled by Geo Ventures, and it's very good because they don't have the same regulations to decrease their current ownership of the companies that they have invested in as opposed to Geo Ventures, which are actually having this regulation in their long-term ownership. They need to be able to help other new companies coming up from university. But their ownership right now is only 3.8, and it was much higher earlier. So they don't have so much more to sell out. And Mivac is the good news. They will probably not sell out anything more than they have right now. So we are happy with that. And then we have a few private investors. I noticed that some of them are sitting in this room, but very importantly, some of the people who came in early, and also the inventors, all of these guys here, not Jan and not Per, but all the others have been involved all the time since the company was established back in 2011. So the burden of Alzheimer's disease, I don't need to go into detail here, right? Because you all know it's a terrible disease. It's costing a fortune. It's spreading. It's becoming more and more of a problem. The reason behind it is that we get older, and as we get older, we tend to get this illness more and more. But I would like just to share with you the enormous cost that is currently estimated. So it's $1 trillion. I had to Google how much that is when I read it. So it's called trillion, and in Swedish it's not called trillion. It's called something else. But it's a huge number, and it's a zero with 12 zero, or 1 with 12 zeros, and it's actually more than 1% of the global GNP. So it's costing us super much money for the society, which is important to remember. And well, they believe that the current market size of the drugs that are available is around $5 billion. And when new possible drugs will enter later on, which will have a much more effect on the disease, they will triple. So it's going to be a whole new market. And most probably, the drugs which are in here now will not be used anymore because they will be obsolete. So the new drugs will take over the whole market. And also very interestingly, the authorities are also backing this situation, because they understand that in order for us to get some kind of solution to the problem of Alzheimer's disease, they need to help. They cannot be too strict in accepting new drug applications. I am, for myself, for instance, sitting in a group together with Socialstyrelsen and TLV and Läkemedelsverket, and together with some other companies developing new therapies for Alzheimer's. And they are actually pushing us to make plans for our clinical trials to be as open as possible, to speed up, to come to market earlier. This is important. This is something that they really want to help and to do whatever they can. So it's a fast track and before symptoms and modifying endpoints. These are just a few. I want to look at this slide for just a second, because it describes a little bit, hopefully, what is behind the disease, Alzheimer's disease. We know that this peptide, amyloid beta 42, you should remember this peptide. It's a very important one. However, they are available in different forms. So they are monomeric forms, which are circulating all over the body. Some may be doctors in here, so you have to correct me if I'm wrong. But this is how it works. A beta 42 monomeric forms are circulating all around the body. And I have just made a blue point here, so this will later on be the one that describes the monomeric forms. And then there are the fibrillary forms and the oligomers. These two are in the brain. That's when the monomers start to aggregate. And what we have seen when we look at patients who have died is that they got huge amount of these fibrillary forms, the plaques. However, this is also the case for people who died who are not having Alzheimer's disease. For a long time, many scientists believed that the plaques were the real problem. It doesn't seem to be true. So we look now at the oligomers, which is clearly having a disease causing synapse dysfunction and causing cell death. So this is what you see in an Alzheimer brain as compared to a normal brain. It's much smaller, and it's because of all this cell death. And it doesn't really work as it's supposed to do. So here is the real bad guy. This is the one that we really should be looking for. Oligomers, that's the target. And when we look at what has been developed, I just first want to make you aware of all these companies down here. You remember, I think, every one of them. These are all the big pharma companies. What they have in common here is that none of them were the inventors of the drugs that they are trying to develop. They come from small companies such as Alzinova. So they buy companies and they buy assets which they can develop and take to the market. That's how it works. But the first drugs, immunotherapeutic drugs that came on market, were the ones who targeted the monomeric form, or actually all forms, but because the monomerics are like 90% of all A beta which is out there, and the antibodies are not very smart. So as soon as they find something to bind to, which they are designed to bind to, they hook on, and that's where they stay. And these are quite harmless. So what happened was that there were no clinical effects, but however there were these side effects, ARIAs, amyloid-related imaging abnormalities, which is brain swelling. The brain start to be edemic. So it leaks out amyloid beta and causes this severe side effects. It's a problem because some of these drugs has actually showed some interesting results. but they also show higher side effect profile, so that could be a problem. The second generation here is more targeting all these form of aggregated forms. Same thing again, they are about 10 times more of these fibrillix than the oligomers, which is causing them to mostly bind to the fibrils. And there are signs of clinical benefit here, and there are, of course, these side effects. So we are now developing this very unique product, which is only targeting the oligomeric forms, and that's what makes this drug so interesting. And also, I should add here that what our drug is doing, it's an active vaccine, so it's not antibodies made in a lab. We give the patient our small oligomers, so the body starts to produce their own antibodies. So this is where this A-beta-CC comes back. It's our way of putting the synthetic form of the oligomers into the arm of the patient, and the patient's body starts to wonder, what is this? I have to eradicate it, and starts to build up antibodies. And this is how our approach is working. Whereas most of all these other guys here, they are doing the antibody outside the body and then have to inject it every 2-3 weeks for the rest of the patient's lives. Whereas we can just wake up the immune response and then maybe give booster doses every now and then. So that's the difference. So we are going into first in human in 2018 with this oligomer-specific active vaccine. That would be fantastic, don't you think? So, and also interestingly, targeting the A-beta oligomers is something that everybody around the globe now talk about in the real big clinical symposias. Professor Selko, who is maybe #1 in the world, he's talking about the oligomeric forms of A-beta. Dr. Maslia, US Institute of Aging, also talks about the targeted aggregated forms, the oligomers. Benilova in Nature's Neuroscience talks about the oligomers show the highest degree of neurotoxicity. So this is really the form that we should be looking for. I have to watch It's on 11 now, so it should be a couple of more minutes, right? Yeah. Yeah. So Biogen is really muscling up now for the future. We know that Biogen has one of the most interesting products in their pipeline. And I want to spend a few minutes on Biogen because they have developed this aducanumab, which is actually a monoclonal antibody. It's a passive vaccine. It has shown, given to patients in 2 big phase 1 clinical trials, that they show benefit on effects on cognition. And they also show effects on biomarkers in patients, which is very, very important. So they are moving into phase 3, and they have been coming far in this phase 3 trial. And everybody thinks now that it's becoming more and more belief that this drug will enter the market. There are market people who think that it's somewhere between 60 and 65% probability that they enter the market. Evaluate Pharma estimates the net present value of aducanumab to $10 billion. That's 80 billion Swedish crowns for a drug which is not even on the market yet. And this drug, as I just tried to explain, is then a drug which is similar to the one that we are developing, but it's less specific to the oligomeric forms, and it's a passive vaccine, whereas ours is an active vaccine. So if you have any questions around this, please ask, because it's not so easy to understand. So we have had a fantastic positive preclinical project going on now for the last 2 years. We have currently very soon developed a model to produce the actual drug product, so it can be produced in the factory. So it's not just in a lab. It has to be done GMP-wise in the factory. And we have also shown that we have in different species, such as mice and rabbits, and also in a small study on monkeys, we have shown that it's showing toxic, very stable effects. So no toxic effects. We have seen nothing on any inner organs. We don't see any problem within the injection place. We have also investigated the immunogenicity, which is does the product kick on the immune response in these species, and it's very clear it does. And it's also showing very strong production of the right form of immune response. It's very important that you don't bring up the Th1 as opposed to Th2. Th2 is what you want to produce, because that will give the patient an effect without causing side effects. But it's much more complicated than that. And but this is very important when you do this kind of development, that you don't create the Th1, but instead the Th2. That's actually one of the biggest products was cancelled because they caused the wrong side or the wrong type of T cells response. In this case, we have been looking at these are transgenic mice, so they have an A-beta pathology, and we have given them vaccination. So they are transgenic in a way to try and mimic the Alzheimer's disease from a human. And what can be shown is that the synapse function is going down, here measured by synapse density. So this is how far these poor transgenic mice can produce synaptic function on a scale from 0 up to here. And if you give these animals our vaccine, then they increase their synapse function up with 50%, which is a significant difference. And this is also the level where wild-type mice have their synaptic function. So this is, you can imagine if we could do the same on patients who has typically a dysfunctional synapse function. So this is one example of the animal models that we have been tested, and there are many more of them. Okay, this is a possible way to market with ALZ-101, our active vaccine. So we are currently in the preclinical phase. Hopefully we will be ending by the end of this year, and we can start then the phase 1B. Phase 1B stands for, normally you do phase 1 with the healthy volunteers. With this B means that we don't do it on healthy volunteers, but instead on patients. So it's a kind of moving into a small phase 2 immediately. And the reason behind this is that we want to have some kind of abnormalities with A-beta, so that we can do this biomarker measurement. And then it's possible to, we will be looking for partners who can help us and develop the product. It's possible that we do a phase 1B extension. so that we just take the same protocol and we just fill up with more patients. That could be a way, but we could also do it phase 2 extension. So we do just extend the phase 1b and move into phase 2. And the reason behind that is that we could then add placebo and a lot of more patients so that we could show some effects compared to something. But this is open for discussion, and cost-wise, it's not really different if we do 1B extension or phase 2. Anyway, important message here is that this includes a fast track. So that will definitely be something that we will chase for.
Talking about fast track, Per, we should go to questions and answers in a couple of minutes.
Yeah, good. So phase 3 is coming up, NDA, new drug application and on market. And this is just the message here is that nobody believes that the future AD product will take one product will make the whole difference. There is no such therapeutic area. All big therapeutic areas, cardiovascular, cancer, diabetes, we all have a combination of different drugs. So we hope that ALZ will be a cornerstone in such a scenario. Intellectual property, we have blocked the whole globe for marketing if we want so there it's very strong here. And we are opening for new issues offering. So this is something that is possible to come in as a new share owner of the company. And this is something that we wanted to open for with the last annual general meeting. And it is presently something that is possible to do. We have a new offering opening at the next annual general meeting on the 17th of May, where we will propose 600,000 shares. So anybody who is long-term interested to share our way to the future and help the company moving into this phase 1B, then that is an opportunity that you can step into. Thank you very much.
Thank you, Per. Okay, so let's give you some questions to answer and to enlighten us. If we look at where you are with ALS 101, it's a long way from the market, and you are doing this to do a phase 1B study, where the B stands for you're actually doing this. I know it's in Finland, and it's on moderate Alzheimer affected patients.
Yeah, that's correct.
Okay.
Yeah, fully correct.
Yeah. Okay. But so if we compare the regular numbers, I looked on Wikipedia.
Yeah.
Phase 1, 70% success rate. Phase 2, 33%. Yeah. Normally deals are after phase 2 because then you're showing an effect. And then you have phase 3, I think it's about 70 again. So 70 times 0.7 times 0.33 times 0.7. Then we have, do we have Patrick from analyst group here? Hi, Patrick. Numbers are pretty extreme for Alzinova. Patrick has you at the failure risk for you not becoming a treatment for Alzheimer's is over 90%. Is that correct?
Yes, that's correct. Should I come up? Or
now we'll talk more at it. On the lunch. So it's huge risk still. The value is enormous. So you're asking the shareholders to take a big risk, but also potentially have a big reward. But if we go back to this, how you want to play it, you want to partner up after phase 1B. why do you think that will be a good strategy, and will that work for you?
I think it will work, and the reason behind that is, and that's also why we wanted to have this as a phase 1b, actually doing it on patients, because we can then do these biomarker measurements. And the biomarkers will clearly tell if we can have an influence on the biomarkers, which is going to happen because our antibodies that is produced by ALZ-101 are effective on the actual disease, on these oligomeric forms. The oligomers are involved in producing a lot of these biomarkers. So if we can control them, then we can control the biomarkers. So, for instance, there is a very, very well-known biomarker which is called phospho-tau and total tau. Tau is another peptide, and it actually increases in patients who have Alzheimer's. That's a very, very clear sign. If we can have a degree in phospho-tau and total tau after, and this will happen within 3 months of treatment. So when we start, we can have the reading of the 3 months of treatment and see if there is something happening there. So this is then, I mean, that would be a fantastic result for us. And to be honest, I think with such an outcome, I mean, we have been talking to several big pharma companies already. With such an outcome, they are definitely grading up their interest in Alzinova. There is no question about that. So moving into phase 1b, which is in a way of moving into a small phase 2 actually, is making this possible. And just a comment also on the very low probability, I think we should remember that we are now in the end part of the pre-clinical phase. So we have already almost done the CMC part, and it's looking very, very promising. We are long way into the GLP tox on the monkeys. None of them have diseased, or none of them have shown any side effects that could be problematic. They are all in their caves, playing like a monkey should be, and we believe it's looking very, very good. So probability from here, if you compare to starting a preclinical project, we have now come so far, so probability of going into the clinical phase is actually improved a lot.
Any question from the audience? I was very close to pulling a "you forgot something" joke here, but I will not. Okay, so I think if there are no more questions, we should leave you to it then and catch your breath. And some of us will join you for an investor lunch where we talk more freely off camera about Alzinova
and in Swedish, I think.
Yes, yes, it will be. Thank you,
Sorry
Per
about
Wester,
that.
Alzinova.
Thank you.